looking at disparities as the differences in incidence and prevalence of health conditions and health status between groups based on these kind of categories: race and ethnicity, SES, sexual orientation, etc. Disparities denotes differences whether they are unjust or not. Inequity denotes differences in health outcomes that are systematic, avoidable, and unjust. As the authors found here, even when things like we consider protectors, our income, our education, healthcare, insurance, are controlled for, these disparities persisted. Even though we're talking about health today, you see these disparities come up in multiple venues, whether it's education, homelessness, again, they persist. Research that's been published subsequent to 2002 have demonstrated there is evidence of bias in some of the things that we're seeing as it relates to healthcare. There's issues of trust that people of color have with the medical system and research in general, but even with that, that does not explain all of the disparities that we see. There's been a lot of attention recently in terms of prenatal and maternal health care. Black women with advanced degrees have worse outcomes than white women that drop out of high school. While we've made some gains in most of these areas, we still see medical errors with people of color having to wait for procedures. Again, just general poor communication, having to wait more to see the provider. Equity and the concern with, again, people getting what they need in the healthcare system lags behind. Some recommendations that were made if we wanted to move the needle as it relates to disparities: increase awareness of existence of disparities. They're not new, but for many people, they are on the radar screen for the first time, in part because of COVID-19. We also were encouraged to address the systems of care. If COVID-19 is currently overwhelming the system and equity was the problem before COVID-19, again, what's the capacity of the system to handle this additional stress? In order for us to really begin to dive deeper into what some of these things mean, we have to be able to collect meaningful data. When we're talking about, again, COVID-19, we're not consistently reporting race. And again, there's a big push for that. If we don't report on race consistently, we don't see the privilege gap in the data. And so what do I mean by the privilege gap? When we say stay at home, that's not an option for essential workers. It also assumes that I have a home. When we say wash our hands, we're assuming, again, that I have a place to wash my hands. There are still places in the United States where people don't have running water on a regular basis. If you happen to be Black or brown, you're more likely to be ticketed for not wearing a mask. If you don't wear a mask, in some situations, you will be harassed. If you do wear a mask, you will be asked to leave the premises. So this idea of privilege, we assume that wearing the mask for everyone means the same thing, and there's evidence that it doesn't. Disasters always expose the inequities. What happens now that these things are getting the spotlight? Will it be the status quo, or will there be significant changes? There's a chance for us to reimagine what health and healthcare looks like in this country, and I would hate for us to lose the opportunity and just kind of push it down the road. Again, I started in 1890, we're now in 2020, and the issues persist.